central retinal vein occlusion. Now, central retinal vein occlusion, known as CRVO, is actually quite a common retinal vascular disorder caused by thrombosis of the central retinal vein, typically at the lamina cribrosa, and it leads to this venous stasis, retinal hemorrhages, and it can also lead to macular edema and ischemia. And so CRVO can be classified as non-ischemic and ischemic, but if it's ischemic, there's a higher risk of complications. And at the slit lamp, which is what we're examining with my favourite device, early findings will include that venous engorgement and those dilated tortuous retinal veins. But in ischemic vein occlusion, you may also observe a relative afferent pupillary defect, retinal whitening, but critically, in the anterior segment, you can also see complications such as iris neovascularization, also known as iris rubeosis. And that can typically emerge around 4 weeks after diagnosis and after the event in ischemic CRVO, but it can occur earlier. And those are seen by these fragile vessels appearing at the pupillary margin, and they can extend across the iris surface. And I have got videos already of quite profound iris neovascularization. This is a problem because it can lead to neovascular glaucoma. And so if you detect it, it's very important to consider arranging pan-retinal photocoagulation, also known as PRP, or even anti-VEGF therapy to prevent damage to the optic nerve caused by raised intraocular pressure, and that can be really sight or even eye saving. So make sure you remember this and keep it in mind, and I hope you enjoyed this video.